Hospital and serves as a vice principal of the Sri Institute of Physiotherapy. Dr. Sandhya has been instrumental in setting up departments like osteopathy, psychology, and Ayurveda, and also brings strong administrative expertise as a former CEO of Sri University Ayurveda College. Her journey reflects a blend of clinical excellence, academic leadership, and visionary administration. We warmly welcome to our live program, ma'am.
Thank you. Thank you, Dr. Ellen.
So, ma'am, as the World Physiotherapy Day, the word physiotherapy repeats everywhere. So, today in this world, without physiotherapy is nothing moving on. So, can you explain what is physiotherapy for a normal layman? Because some, if you ask the people, means they used to tell physiotherapy is a kind of massage. They used to press the body and leave. So, can you explain detail what is physiotherapy to the normal people?
Thank you for the introduction, Dr. Ellen. First of all, through this platform, I would like to convey congratulations to all the physiotherapists around the globe who are working so hard and providing services for the humanity. Happy World's Physiotherapy Day. And as you've asked Dr. Ellen about physiotherapy, yes, earlier it was the notion that it is an exercise therapy only or a kind of massage therapy. But now people are much aware about the term physiotherapy, and many people are taking services as well. I think every member of the home takes physiotherapy at some point of time. So, what physiotherapy is basically, it is a healthcare profession which is dedicated in helping people to recover and improve their movements, not only movements, but also their function and overall physical well being. Whether someone is recovering from an injury, or is living with a chronic condition, or is managing pain, or is willing or aiming to prevent future problems. So, physiotherapy, it provides a personalized, evidence based approach to healing, wellness, and health promotion. At its core, if you see, physiotherapy is more than just treating the symptoms. It is about understanding the underlying cause of the problem. The physiotherapy, it also empowers the individuals by active role of the people in their recovery process. So everyone has to participate in their recovery process, in their treatment plan, for better functional abilities and for improving the functional status. Along with that, physiotherapists are very trained professionals. Earlier, it was DPT people who were managing the same, then came only bachelor's degrees. But nowadays, along with 5 years bachelor degree program, there is a master's training program, and various specializations are there, and super specialization in manipulations and spinal care. So many things are there. So, physiotherapists, they are trained to assess the body holistically, not only the site of the injury, the structure involved, but also the contributing factors, maybe posture, muscle strength, imbalances, or even the psychosocial influences like stress or even fear of movement. So many people have. So it is a systematic approach where a detailed assessment examination is done, and then the treatment also. Physiotherapy treatment is a wide array where a combination of either manual therapy, which includes manipulations, mobilizations, or soft tissue release, is used, along with therapeutic exercises. The in therapeutic exercises also stage wise, a regime is given in which patient actively involves passive, active assisted, active, strengthening. So a whole protocol is developed. Along with that, education plays a very important role. Counseling plays a very important role in the treatment process. And in most of the cases, we also use technology based interventions. So technologically, we are improving so much. We have robotics now. We have gait analysis, gait labs, and so many biomedical engineering has contributed a lot for technological advancements, which gives us tracking also. So, electrotherapy is also part of the physiotherapy treatment. But I would say that perhaps the most important part the physiotherapist use is clinical reasoning, the ability to tailor the program according to the individual's need. So that is one thing which cannot be missed. Also, physiotherapy plays a crucial role across the lifespan, whether antenatal, postnatal care, then in children also who have developmental issues, then in athletes, rehabilitation of the athletes, also in the older individuals in supporting the geriatric cases with movement issues, with instability issues, with functional independence, with physical independence. It is across the lifespan. It is so much important role it has played. And if you see physiotherapy in any hospital setup, then as soon as the patient comes in the ICU, the intervention of physiotherapy is there. Until the patient discharges, physiotherapy is one thing which cannot be neglected, which cannot be taken away. So it is like a heart of the treatment protocol and the interdisciplinary or multidisciplinary treatment approach. So, in post surgical, pre surgical conditions, also, you know that physiotherapy is must these days, and also in neurological cases. So, ultimately, physiotherapy is not just about reducing the pain or bringing patient back to the normal, but it is more about optimizing patient's health, movement, function, and the quality of life. So that
Thank you.
is what holistically physiotherapy means.
Thank you, ma'am. As you said that you are dealing with complex cases, can you say your clinical reasoning of the complex cases which you have gone through in your practice?
See, a lot of neurological cases we see, which are very complex cases, spinal disc issues, and a lot of other complex issues also in ICU also. So, in all the complex cases, I start with the pattern recognition. I also test my hypothesis and layer in involvement of the complex structures. Like, say, for example, a long-standing case of shoulder pain. So I have to first check, is it coming from the pectorals tightness, or pectorals over contraction, or clavicular fracture. Then I have to check if it is with the shoulder joint issues, something is causing the problem. Then the cervical spine muscles or the associated structures, or scapular dyskinesia is causing the same, or any neurological issues. So I consider a regional interdependence model and testing it in layers and ruling out one after the other, then formation of a stage wise rehabilitation plan.
Thank you, ma'am. So, if we are common people, if they are having fever, means they are going for a general physician. Like that, when a patient should definitely see a physiotherapist.
Yes, see, earlier it was a thing that physicians used to refer the patients, orthopedicians used to refer the patient, neurosurgeons, or from all the domains. People used to be referrals to the physiotherapy department. But nowadays, because of so many effects that are visible to the people and they have themselves experienced the same, so walk-ins are also a lot, and when patient needs to consider physiotherapy is when he or she has any kinds of pain, movement limitation, any kind of weakness or strength related issues, instability, or there are recurring injuries, or for any functional or for physical independence, or any musculoskeletal condition, a neurological condition, people can directly walk in for physiotherapy.
So, what will be the future of physiotherapy in terms of technological advancements. Can you say about any technological advancement in physiotherapy?
Definitely about technological advancements, I will speak up. But physiotherapy overall in last 3 to 4 decades has seen tremendous growth. Uh, See, from inclusion into the primary healthcare centers, secondary healthcare centers, tertiary healthcare centers, any hospital is not complete without a physiotherapy department. Placements, if we talk about for the young physiotherapists around the globe, physiotherapist demand is day by day increasing. Colleges are increasing. Along with that, you see now we were struggling with our own council for last more than 3 decades. We have our own council at the central level, at the state level. All the states have their own councils now. So recognition is also there now. And nationally also, people who, all the physiotherapists who want to go for their own private clinical setups can go for the same. For any nursing care, they'll get a good job opportunities in nursing care hospitals or in any kind of hospital, even in sports academies, even in corporates nowadays for their own, for people are recruiting physiotherapists for their people's healthy lives and physical wellness. So future anyways is good. And in terms of technology, see, AI is increasing, so AI based tracking is improved now, will be growing further. Digital rehab I see is increasing and will grow more. Telehealth also will be there. And of course, like robotics, hydrotherapy equipments, all the things, they are anyways improving only. So a good future and good treatment approaches developing with the technological advancements.
Thank you, ma'am, for your clear clarification about what is a physiotherapy, when a patient should seek a physiotherapist, and what are the futures. So we'll go for a next thing about a few questions, ma'am. So, what is your opinion about painkillers or injection in the condition of osteoarthritis of knee joint?
See, painkillers or injections, definitely they have a side effect. But in case when the pain is very much acute or is flared up, then one can use or take painkillers or injections. But if you're seeking for a long-term relief, then it will only come, especially in knee arthritis. It is also chronic condition, gradually developed, and it will continue. It is a progressive disorder also. So, one should aim to have a good treatment plan, inclusive of exercise therapy. Weight management is very important in knee care, and also the therapy, the treatment module.
Thank you. So next thing is if some injuries happen, means they used to tell keep out pack or cold pack. So when should it be keep? When should be the out pack should be kept? When should be the cold pack should be used?
See, it is very clear. Cold packs are generally used for acute injuries, sudden injuries. So, from 0 to 48 to 72 hours of the injuries, cold packs should be used. And in case of swelling, cold packs can be used. Any kind of injuries, suddenly you should rely on the cold packs. Hot packs are used mostly in the chronic conditions.
So if you see for day-to-day patients means they used to wear they called as support for their lumbar support for a kneecap. So is this recommended to wear the supports for their pain man?
See, supports in the case of orthotics, these braces, these lumbosacral belts or cervical collars and all, these definitely help again in the acute phases of the pain and also to support the activities. It also reduces the weight bearing on the joints and the structures. So, yes, it definitely helps, but we should not forget that, and I will not recommend it to patients for a long term use or for a regular use, because more you use supports, more your muscles, your body will be dependent on the same, and the weakness of the muscle increases. So, to prevent weakness of the muscle, it is advised to use it as limited as possible and only in the acute phases.
So in condition like OAE, the patient is too much obese. If they reduce means it will help in the pain management for them.
See, we always know that kinetics and kinematics are to be taken care for the healthy individual. So weight bearing, load bearing on the joint structures. If a person is obese, then ultimately the lower limbs, the back, the structures will be bearing more load. And even a significantly few kgs of weight loss, it will significantly affect the load bearing on the joint structures. So, weight management is very much important to reduce the pressure on the knees, basically. So, in OA, yes, weight management, or in anything, anyways, weight management and proper weight is definitely very much important for health and proper load distribution, for proper biomechanics of the body as well.
Thank you. So if you take hospital survey, maximum patients will complain about low back pain. So what will be the cause for the low back pain? Either it is a young patient or an elder patient.
See, low back pain, everyone in their lifespan, once at least, they will experience the low back pain. And low back pain is a very weak thing, means it can happen due to posture, stress, any kind of injuries, fall on the back, or any kind of fall can also contribute to the same. Stress, as I said, will contribute. Also, muscle strain, poor posture. Many people are not aware of the same, but poor posture is the leading cause of low back pain. And too much of sedentary lifestyle. So you know that muscles, and they have a rule that use it or lose it. So to appropriately use the muscles, uh, it is required to be healthy. So low back pain can happen due to anything: posture, stress, injuries, neurological issues, muscle strain.
As we are speaking about low back pain, can slip disc can heal without surgery?
Yes, of course, many disc issues we have seen that they recover with a proper therapy, with a proper exercise plan, and with time as well. Many disc issues they heal.
As we see in many Instagram reels or YouTube reels, they used to do some cracking method, twisting method. It is completely safe for the patients, ma'am.
Yes, these days cracking manipulations, these are on trend in reels, but see, and it is useful also if it is taken by an expert and a professional. It definitely helps in realignment of the structures. So manipulations are advised, they can be taken uh, technically by only an expert, professionally trained person only, a physiotherapist only, but it is not for everyone.
So, if any case of cervical condition like cervical spondylosis, it will lead to cause headache. Any relation is there?
Yes, cervicogenic headaches. They basically arise from the issues of the upper cervical spine, increase in muscle tension of the upper cervical spine structures or muscles only, and also due to the neurological conditions, neurological interventions or issues. Cervicogenic headaches are common.
So, if you take in clinical practice, next thing is patient used to complain with shoulder pain. For example, frozen shoulder. So, in case of frozen shoulder, do we can do exercise during pain?
See, the phase of frozen shoulder is very big. Anna. So, you know, it happens in three phases. So, first is the painful phase only. So, if you will not do if the patient doesn't do any kind of exercises, then it can lead to more stiffness. So, pain during the exercise is mild pain is okay. Discomfort or aggravation of the pain is a sign to consult back with the physiotherapist and realign with the exercises, reassessment to be done, which kind of exercises to be initiated at that painful stage. But I would say that gentle movement is the key. Forcing the movements, it may aggravate the inflammation.
Does frozen shoulder will recover fully, ma'am? But what
Yes,
will be
yes,
the
yes, yes, yes. Mostly patient regain full function, complete full ranges, uh, full strength also. Yes, it is a time taking activity, but people regain full function and independence in all the ranges, strength, everything with proper treatment and proper exercise protocol.
so what is the best
But
position
home
sleeping?
home care is equally important. Home exercise plan is equally important. Discipline of exercise is equally important in frozen shoulder cases.
So generally, if patient is having any pain, either shoulder, low back, anything, so doing exercise during the pain, it's completely safe.
Sorry, during the
Yes.
exercise is it safe?
Yeah, during pain is there. Patient is doing exercise meters. Okay.
So mild discomfort is okay, but worsening pain, one we can feel no during the exercise. Okay, this is a good pain that is helping us, or that is in the positive side. But a bad pain uh, is not okay. Mild discomfort is okay.
So, ma'am, if take
Pushing is
anything,
not okay. Forcing the movements despite of the pain is not okay. It will worsen the inflammation.
okay. So, ma'am, can
Overstretching is not okay. A gentle approach.
can physiotherapy can help with chronic pain? Some patient used to complain, I'm having this pain for more than 10 years, 8 years. It will be helpful for
Yes,
them physiotherapy treatment.
yes, of course. In chronic conditions, physiotherapy is very much useful in regaining the strength of the structures involved in full range of motion and in balance, coordination. So many activities, of course.
Thank you, ma'am. So thank you for your valuable time on the occasion of World Physiotherapy Day. Some clarities we got regarding physiotherapy. So what is physiotherapy? How it should be approached? What and all the physiotherapies can be done? Thank you for that, ma'am.
Thank you. Also, here I would like to add that in Sri Sri Ayurveda Hospital, we have a very nice and well developed Sri Sri Center of Physiotherapy. Also, our physiotherapy department is well equipped with all the electrotherapy devices, with professional experts for care and proper treatment planning, individualized, personalized treatment approach. And also, we are starting our physiotherapy college very soon. So, I invite people to visit us at Sri Sri Ayurveda Hospital and Sri Sri Department of Physiotherapy to take the benefits of the same.
Thank you. So here I warmly invite all our live participants to visit the physiotherapy department at Sri Sri Ayurveda Hospital for a comprehensive physiotherapy treatment. As you can come as a both outpatient or a inpatient, we have specialized in orthopedic rehabilitation, neuro rehabilitation, pediatric rehabilitation, sports rehabilitation, along with expert physiotherapy care. You can also consult our Ayurveda doctors, especially in various branches like Panchakarma, etc. So experience your integrated care designed to restore your health and well-being. So once again, I wish World Physiotherapy Day. Thank you, ma'am. So thank
Thank
you
you.
all for
Thank you
joining
for
us.
inviting me.
So thank you all for joining us today in the celebration of World Physiotherapy Day. It has been an honor to moderate this insightful section with Dr. Sandhya Sadhana, whose expertise and vision have truly enriched our understanding the vital role physiotherapy plays in day-to-day health. We appreciate your active participation and thoughtful questions. So stay inspired, stay healthy. Let's continue to support and recognize the incredible work of the physiotherapist everywhere. Have a wonderful day. Once again, a happy Physiotherapist Day. Thank you, everyone.
Thank you. Jai Guru.